Hello, welcome to Walk, Don't Run to the Doctor with Miles Hassel, MD. This is an evidence-based podcast for people who want to use lifestyle choices to avoid preventable illness, as well as to treat illness. Listeners will learn the choices that work for better health outcomes for themselves, the ones that they love, and the patients they care for. We want to see patients liberated from the burden of chronic disease whenever possible. Well, welcome. Last time we talked quite a bit about autoimmune disease and inflammation, and this time we'll be just finishing off that. So the first time we talked about where autoimmunity and inflammation can be influenced by physical activity, fitness, muscle mass, the diet, microbiome, microbiome being the population of healthy bugs and beneficial bugs and other components in the gastrointestinal tract. And today we're going to talk about waistline, sunlight, heat, and sleep as other tools that you can use. And you'll notice that there's a lot of material here. In other words, depending on how you count them all, there's 6 or 7 tools that you or your patients have. When you think about these tools and think about lifestyle medicine, remember that there's no one silver bullet that we're ever talking about with lifestyle medicine. We're talking about using 3, 4, 5, 6, 7 different modalities to improve your health outcome or your patient's health outcome in really significant ways. So keep thinking as we're talking, keep remembering this is part of a big blend, and any one ingredient in this blend may not be suitable for every patient. So talking about waistline, sunlight, heat, and sleep. It is an unfortunate fact that people who are overweight tend to have more severe manifestations of autoimmune disease. And people who are slimmer with more fitness, better muscle mass, tend to have a milder disease course. And this has huge implications. If you have a milder disease course, you don't need as much medication. That can reduce your costs, it can reduce side effects, and so on. So it's important stuff. As we talk about losing inches around the waist to improve outcomes from autoimmune disease, it dovetails with what we discussed in the last session regarding fitness and muscle mass as part of our autoimmunity and lifestyle discussion. And that may relate partly to metabolic rate, for example. There's all kinds of hormonal factors involved. The mechanisms are legion. And if you're somebody who struggles with weight loss and weight loss failures, I encourage you to realize that everyone can lose weight. It's just a question of what is the right way to do it for yourself. But it is doable. No matter how many times you failed, there is a way that you can lose weight. And the way if you have had a lot of failure in this area, then you say, hey, I can't do this on my own. Work with somebody with a track record for healthy weight loss. It might be a physician, might be a dietitian. It may just be a good friend across the back fence who's managed to make this happen. And listen carefully to what they do and do it yourself. We go into the process here of weight loss quite a bit in our book, Good Food, Great Medicine, and in a new module that we're developing for our website, greatmed.org. But here, I'll just touch on a few high points to think about as you're in your own journey, or if you're trying to help patients in their journey. Whole food diets, mostly cooked at home, appear to be really, really helpful for most people. In fact, people who eat more food outside the home have much harder time losing weight. Begin every meal and snack with whole fruit or vegetables to which you add protein, whole grains, beans, nuts, whatever else you're going to eat. By starting every meal and snack with whole fruit or vegetables, you simply don't eat quite as much. And so you're filling your stomach and satisfying your basic urge to eat with low calorie density foods. Include probiotic foods most days. These include things like yogurt and kefir and fresh sauerkraut and kombucha and so on. And that addresses the critical microbiome side of this whole thing. Avoid highly concentrated calories. So that's foods made with flour, such as breads and pastas and crackers and pastries. Avoid sweets and sweet drinks. These things are just deadly to weight loss. If you can't control your ability to drink sodas or juices, then you're going to have a much greater struggle with weight loss and probably with your autoimmune disease, because the simple carbohydrates that we talk about with both the foods made with flour and your sweets and sweet drinks These highly concentrated carbohydrates also seem to have an immunosuppressive effect in and of themselves, which is the last thing you want, is to have an aberrant immune response in your own body. You've already got enough of a problem in that way regard. There are other methods that can help. One of the common ones that people use are intermittent fasting. And so in our book, we talk about lots of different methods. People you talk to will each have their own things that have worked for them. Realize that something will work for you too, and throw everything you've got at the problem, because it's probably critical to how good you feel in the years to come. We talk a lot about fitness and muscle mass in regards to everything to do with autoimmune disease. And remember that they are very weak weight loss tools. They're fabulous health tools. They're fabulous tools for improving immune modulation in a healthy way. They also help weight maintenance and weight redistribution. So you're more likely to lose weight off of the areas that you want to lose it, such as your waist, and put it on other areas. But don't expect your weight program to be a powerful tool for your weight loss. If you're not losing weight, it still means you're eating too much. And so while you're trying to lose weight, keep up your 2 or 3 times a day daily exercise habit. Even if each of those doses of exercise are very brief, like 1 minute, but do it because they're healthy. Don't be disappointed in your exercise if it doesn't create weight loss. Now we're going to be talking about sunlight as a tool for autoimmune disease, and sunlight exposure has a rich history for improving human health, and it appears that exposure to non-burning sunlight has a significant health benefits that don't involve increasing your melanoma risk, which is a question we get quite often. And in the show notes, you're going to see a couple of papers that discuss this complex subject in detail, and it's also something to review with your doctor depending on your particular disease situation and the medications you're on. The most notable disease for which sunlight has been shown to be beneficial is in the autoimmune world is multiple sclerosis. Exactly how sunlight works to improve autoimmune disease is unclear. It may involve vitamin D. Very likely, however, it includes many other mechanisms that we understand poorly. My typical prescription for the summer months in the Pacific Northwest of the United States is 10 to 15 minutes on each side of the body with maximum square inches of skin exposed. In other words, not wearing a lot of clothes and without sunscreen. This is an extremely controversial area of medicine because of concerns in part for both aging and skin cancer. And so talking it over with your doctor, reading our resource papers in the show notes can be really helpful for you. In addition, of course, it's also unfortunate some of our medications or the autoimmune condition itself may make direct sunlight unpleasant. And so remember, the sunlight treatment is not for everyone. And we're going to be talking a little bit about individualizing lifestyle medicine at the end of this. The next thing we're going to talk about is sauna bathing, or sauna. And this is an ancient lifestyle practice that has been associated with a broad range of improved health outcomes, including longevity, but also for autoimmune disease. And it's important to realize that sauna bathing, sauna exposure has evidence for benefit for just about every disease process known to man. Typically, saunas involve short periods of exposures, such as 10 to 15 minutes, a few times a week, to temperatures that are as high as anywhere from 120 to 190 degrees Fahrenheit. So these can become really hot. And exactly how saunas work is also unclear. There's numerous mechanisms that are postulated. And but one of them involves this idea of raising your core body temperature. In other words, essentially giving yourself a fever. And it's very likely that the same mechanisms by which sauna works may be the same mechanisms by which some of our exercise tools work for improving health. A hot bath several times a week may have similar benefit. It's certainly biologically plausible if the primary mechanism involves raising the core body temperature. And we typically, I discourage hot tub use in patients who have autoimmune disease because of the various chemicals involved and the infectious disease exposure that's inherent in hot tubs. So although we talk about hot baths and we talk about saunas, we don't think that necessarily translates very well to the area of hot tubs as conventionally used. Now, Not everyone can tolerate the typical temperatures involved with either sauna or hot bath. So, like everything else, this approach needs to be customized to the individual patient's situation. But for many of our patients, it seems to have a dramatic health benefit. The next category we're going to think about is sleep. And the reason is that sleep deprivation has a clear association with exacerbating immune-related disease, including autoimmune disease. And most humans seem to need somewhere between 7 and 9 hours of sleep, and that can be difficult for scheduling. It might be because of work, it might be because of play and recreation, it might be because of socializing. And so the first thing to do when you're looking at using sleep as a positive modality for your autoimmune disease is making scheduling sleep a priority. And along the lines, we could discuss also at some other time the idea of the concerns regarding shift work as having adverse health effects. But that's a little bit beyond the full scope of today's discussion. But worth knowing about that shift work in and of itself is a concern for disease in general and autoimmune disease in particular. Some people don't have any trouble scheduling sleep, but they just don't sleep. And so if you're somebody who has trouble with initiating sleep or maintaining sleep, it's often worth getting a medical opinion about why insomnia might be present. But one of the factors that we encounter commonly is the issue of sleep apnea. For many people, the best treatment for sleep apnea is going to be weight loss. For others, it might be different modalities such as CPAP and various oral appliances. For others, all it may mean is an alteration in their body sleeping position. And there's these things called tennis ball t-shirts and other related modalities that keep you from lying on your back that can be very, very helpful. Talking to your doctor about how to approach this is appropriate. But maybe you don't have sleep apnea. Maybe you don't have any trouble scheduling sleep, but you still aren't sleeping. And we have a module on this also being developed for greatmed.org. And a page on this in our book, Good Food, Great Medicine. But some of the high points are sticking to a bedtime and waking up schedule. Somehow scheduling your sleep in a regular way helps. Having a bedtime snack with protein, often such as dairy foods, helps many people. Alcohol is interesting because it can both interfere with sleep, it can worsen sleep quality, or it can improve sleep. So that's something to discuss with your doctor and find out what works for you. Increased physical activity almost always helps. We like to say that we just don't see exhausted people having trouble sleeping in most cases. There are a handful that still do have trouble there, though. For those, it's worth thinking about another technique called sleep deprivation, which is usually best done through, there's these people called sleep psychologists that can help you with this. But sleep deprivation, there's YouTubes on it. There's various things you can find online about how to apply this in yourself. But that can sort of reset some of your brain sleep functions. For other people, there's a variety of herbs and amino acid supplements that can sometimes be helpful, although we see this helping people rarely. Melatonin is something else that fits into this category. And really, the long-term safety of any of these supplements is a little unclear, but it may be better than not sleeping at all. So think about sleep as yet one more tool that if you're struggling with autoimmune disease that you need to pay more attention to. And so we've talked about waistline, we've talked about heat and sunlight and sleep, all as additional factors for improving outcomes from autoimmune disease, reducing requirements for medication for autoimmune disease, improving quality of life. As with all aspects of medicine, the role for lifestyle modalities, such as we've discussed in these two podcasts, needs to be customized to each individual patient's situation. The disease itself, medications, and symptoms all have impact on how lifestyle interventions can be applied. And so whether you have a symptomatic autoimmune condition yourself or you take care of patients with autoimmune challenges, consider exploring how each of these lifestyle tools can help reduce the burden of both the disease and the burden of treatment for the disease. And remember to be patient. Lifestyle approaches take time to work, especially in autoimmune conditions. The good thing is, each of the lifestyle conditions we've talked about have a broad range of benefits beyond autoimmune disease. These are not silver bullets. These are broad brush approaches to improving your health overall. And so the patients involved saying, hey, the disease I have has taken a long time to develop. Turning that around may also take weeks or even months. And so when you embark on a lifestyle treatment program, be patient, be consistent, be rigorous. Don't let yourself have a whole lot of excuses. And over time, most patients seem to see a dramatic benefit. So whether we're dealing with autoimmune diseases such as ulcerative colitis and Crohn's, or SLE, or MS, or rheumatoid arthritis, or Hashimoto's, or so many others, then physical activity, diet, improving your microbiome and your gastrointestinal tract, your waistline, exposure to sunlight and sauna, and adequate sleep, all may be incredibly useful tools to improve the outcomes that you are hoping for, reduce your reliance on medications, and if you're a clinician taking care of people with autoimmune disease, improve their outcome and your job satisfaction. So thank you very much for listening. The website is greatmed.org. The book is Good Food, Great Medicine by Miles Hassell, MD, and Mia Hassel. And you've been listening to the podcast, Walk, Don't Run to the Doctor. Thank you.